Oxygen delivery. I know I've got an oxygen tank as my tank is white and oxygen tanks are usually black or white, so I'm just going to place this on the ground in front of me lying down. I'm now going to check my regulator, make sure that everything is intact. I will do this by gently removing the Bodex seal on the inside and just checking to see if it's rusty or breaking away at any stage, and it is not, so it appears to be working well. So I'm just going to place that quite firmly back on the inside, and now I will place the regulator back onto my oxygen tank. I will do this by aligning my 3 little prongs into the slots provided and tightening the little dial on the side. Once I have done this, I will now turn my oxygen on by turning the little dial at the top. My oxygen is full as the little dial up the top of here is at the top and not at the bottom. So I will now turn my oxygen off and I will bleed out the remaining oxygen that's left in the regulator. So how I'll do this is by going through the flow rates, and they start from 0 and go up to 25. And I know it is empty when my little dial is now at the bottom and I cannot hear any more oxygen flowing through. So I'll just turn that back to 0. Once I've done this, I will place the oxygen tank on the ground, lying down to avoid combustion. Completing my suction test, it is important to remove it from the power supply to make sure that it is fully charged and can function while out on the road. So when completing my suction test, I am first going to turn it on to full capacity, kink the tube and press the test button. I will know it is completed when it has reached the highest vacuum capacity and is fully charged. Once that's completed, I can now turn it off. While using the suction unit, it's important to cover the hole with your finger of the rigid catheter, and when suctioning, you only suction in a circular motion on the way out, only as far as you can see and for no longer than 10 seconds. While also using the suction unit, it is important to understand the complications, which include hypoxia, bradycardia, increased intracranial pressure, and soft tissue damage. What I'm going to be doing now is my bag check. So what I've got in here is my primary survey equipment. So I have things like my stethoscope, my adult blood pressure cuff, my child blood pressure cuff, my BGL kit, my thermometer, things like my light torch. In the second compartment here, I have things such as like my PPE gear, like my glasses and my facial masks. Now, on this side, I have my hemorrhage control. So I have things like my steri strips, my gauze, my bandages, my tourniquet. On this side, I've got my skin analgesia spray. I have a vomiting bag, and I have my cervical spine lanyard. In this pocket, I've got my diabetic patient control, so I've got my 1 ml glucagon, I've got my oral glucose. Now, in the big compartment, I have my medications such as my paracetamol, my ibuprofen, my tramadol, and my methoxy, and sometimes adrenaline. Down here I've got things like my different sizes of OPA and MPA. I have my adult bag valve mask, my child bag valve mask, my different size LMAs. I've got my advanced airway management control, and on the sides here I have things like my box split, my SAM split, the slippery SAMs, the C-spine collar, and a towel. So I'm now going to demonstrate how to use the life pack. First of all, what I'm going to do is I'm going to check the batteries. So to do this, just flip it round, and then you want to lift up this little patch, and you want to press the button on each battery to see how much life is left, and I can see my batteries are full. So if you want to take the battery out and replace it, all you would do is press the button on the side and remove. And when putting it back in, just put it back the same way, apply pressure, and wait for it to click. Cool, so now we're going to turn this on using the on button. And the first thing I'm going to do is press energy select. And it's going to ask me if I want to enter manual mode, and I am going to turn the dial and select yes. And for the purpose of this video, I'm going to turn it down to 50 joules. just using the dial again. So what I'm going to do now is I'm now going to do a user test. So first I'm going to press the options button, and it's going to bring up a whole lot of options for me, and I'm just going to turn the dial and select user test, and I'm going to select that. This might take a while, so I'm now going to go through each compartment. My right hand pouch, I have my 3-lead ECG leads, my SpO2, my BP cuff, and my ETCO2. And when using the blood pressure cuff, I would press the IPP button here, and it would just do it. Now, in my left hand pouch, I have my indate defib pads, my 12-lead ECG cables, and a plastic bag with G10, aspirin, and a razor. Now, if I wanted to print out what was on my screen, what I would do is press the print button, and as you can see, it's printing out. And when I want to stop, I just press the print button again. So that's it done. Now, in the back pouch, I have a spare roll of paper, and I would change it if my paper roll had run out. And how I would do this is I'll just flip the switch, open it up, and just remove the roll. Lastly, to turn off the life pack, we would just press and hold the on button. First off, when entering my scene, I'm going to check for any dangers. I can't see any, however, I'm just going to check with my offside of Wilson. Can you see any?
No, no dangers here.
Hi Sue, can you hear me? No response to verbal, just going to check the pain. Sue, can you hear me? Still no response. My patient has no eye movement, no verbal and no motor response. So indicates to me that he's got a GCS of 3 and suggests that he is very sick. I'm now going to call for backup. AT1 to comms, requesting R50. So I am now going to place a towel under my patient's head just to elevate, while my offsider connects some leads. So now that I've placed a towel under the head, I'm going to look for any obstructions in the airway. I can't see any, so I am now going to enter in an OPA. When you're entering the OPA, you measure from the mandible to the mouth, and when entering it, you enter it with the curvature facing up, and then halfway down, rotate 180 degrees until it fits into the mouth. The NPA from the earlobe to the nostril, and when entering an NPA, you must use lube. NPA, just put it into the bigger nostril and twist if you feel any resistance. After managing the patient's airway, I'm now going to auscultate the lungs. First listening to the upper left lung. And then to the right lung. And what is it? The lower left. Then I move to the lower left lung. Again, move into the lower right lung, and then I would now move to the right armpit and the left. So my patient appears to have a respiratory rate of 6. I'm now going to check for SpO2 levels, and they are at 84%. Anything below 94% requires the administration of oxygen. So I'm now going to administer oxygen through a bag valve mask. And I'm using a bag valve mask because I want to be administering high levels of oxygen. And I'll have this on a flow rate of 10. After having connected all this up, I will be holding my bag valve mask in a C&E grip and ventilating once every 6 seconds. However, I'm now going to delegate this to my offsider while I finish off some vital signs. I'm going to start by taking the patient's blood pressure. First, I'm going to feel for a brachial pulse, And then that is where I'll place my stethoscope. And when I hear that first noise, that is my systolic. And when I do a slow release, when I can hear the blood pumping through again, that's my diastolic.
100/70, that's what I said.
So the patient's blood pressure is 100/70. Blood pressure, I'm now going to check for heart rate. So when checking this, I'm going to be using my 2 fingers and I'll be putting them on the radial pulse, and I'll be doing this for 15 seconds and multiplying that by 4. While doing this, I'm checking for any fast or slow pulse rates or any irregularities. My patient's heart rate appears to be at 50. However, if you did come across any irregularities, you would take the pulse for 30 seconds and times that by 2. I'm now going to be checking cap refill, first peripherally. That appears to be at 4 seconds, and centrally also about 4 seconds. This shows signs of poor perfusion. I'm going to be doing a temperature on my patient. The patient's temperature appears to be 34.9. I'm now going to do a BGL. So first you would swab the finger with an alcohol swab just in case it's dirty, and then slightly just prick it, and then place the blood onto the little strip. My patient's BGL appears to be 7.0, and I'm now just going to check the pupils. So if you just move to see the reactiveness of each. So patient's pupils appear to be in meiosis. This tells me that they drug overdose. Temperature is at 34.9. This is slightly hypothermic. So in this case, I would get a blanket and cover the patient up just to try and keep some warmth. So I am now going to complete a secondary survey. First, starting off at the head, really getting behind and in the hair and checking the forehead and the facial structures, so the cheekbones and around the mouth and in the teeth. Then the collarbone,
Check your hand.
no blood, so that's all clear. Checking the collarbones and the ribs. Also the sternum, and also checking the shoulders, making sure that there's no irregularities there. Once I've finished the ribs, I will go down to the abdomen, slightly palpating, and then I would go down the arms, so making sure that there's no lacerations or fractures there. Now that I've done the arms, I would move down to the pelvis, and I would make sure I check that quite good, due to the fact that this area can store a lot of blood. And then I would go down each leg. Completed my blood and trauma sweep and find that there's no lacerations or fractures. I would then move on. Due to my patient being unconscious, I could not do a TQRST test or a sample check, and I would also complete a pain check, but again, my patient is unconscious, so I'm not able to do this. And there's also no bystanders around to help me with this.
Gagging.
Remove OPA and flip him onto his side. So now that he's gagging, I'm going to be suctioning in a circular motion. In a circular motion as far as I can see, for no longer than 10 seconds and only on the way out. Once I have finished this, we would then put our patient back onto his back, and I would then again go through my doctor's ABCs and manage the airway while we wait for backup. My scene, I'm checking for any dangers. I can't see any. Can you see any?
Nope.
Hi ma'am, I'm Ahliah, I'm a student paramedic and this is my offside at Wilson. Can you tell me what happened today?
No.
Can anyone tell me what happened today?
She fell 3 meters off the ladder.
Down 3 meters. Can you locate any pain for me? On a pain scale of 1 to 10, 10 being the worst pain you've ever felt, what would you rate your score to be?
8.
8. 81 to Collins requesting R51. So I'm now going to place a towel under the patient's head. Just slightly elevate. And now, ma'am, is it alright if my offsider does a few vitals?
I'll just pop this on your finger.
So while Wilson's doing the vitals, I'm now going to do a full trauma sweep. First starting at the head, checking for any bleeding in the hair or any fractures, forehead, cheekbones, around the eyes, around the chin, then going down to the collarbone, then going down to the shoulders of each arm. I noticed that there's a laceration on the lower left arm, so I'm now going to check the other arm for any other lacerations. Now checking each rib, checking the pelvis. It's important to check this area as it can store a lot of blood. Checking each leg. I notice that there is a deformity on the lower right leg. What would you rate your pain score to be on a scale of 1 to 10?
8.
So I'm now going to administer methoxyflurane. Ma'am, do you have any allergies?
No.
I'm now going to get my partner to check off that it's not expired. In the meantime, I have to ask my patient about the contraindications. Ma'am, do you have a history of malignant hypothermia?
No.
Have you had this in the last week?
No.
And do you have any renal impairments?
No.
Okay, expiry date is August 2020.
Now that this has been checked off by my crew member, I am now going to give this to my patient to administer. The methoxyflurane is self-administered. You just blow in and then inhale. So I'm now going to treat the bleed. First of all, I am going to get a bit of saline and wet some gauze so it does not stick to the wound, and apply pressure to the laceration. When I have done this, I am then going to stick a bandage on.
Just extend your arm. I'm just going to take your blood pressure if that's alright with you.
Bandage this. And twisting to apply pressure to the wound. I'm now going to check for any cardiovascular and neurological impairments. Checking cat briefle. Ma'am, can you feel sensation in this hand? If bleeding has not stopped, I am then going to apply another gauze. Again, applying saline so it does not stick to the wound, and applying another bandage. And again, twisting that to apply more pressure onto the wound. Again, I'm going to check for cat refill. And can you feel the sensation? If bleeding has not stopped, I can slightly elevate the arm. And in worst case scenario, if bleeding still has not stopped, I'm going to take off the bandages and apply a tourniquet. When applying a tourniquet, you apply it 10 centimeters distal from the laceration. When applying a tourniquet, you would twist the windlass till it's tight and cuts off circulation. You would then write the time and date of application, and you would not remove until we have gone to hospital. I'm going to administer oxygen. My patient has an SpO2 of 96, but she is also experiencing some confusion, and this will just help her to breathe a little bit better. And just stick it around the ears and then tighten. Now that I have administered oxygen, I am now going to move on to the deformity in the leg. Move on to the deformity in the leg. I'm first going to check the two legs to see if they are the same colour and if there is any other impairments. So it seems that the right leg is a little bit more. To apply the plus discs acronym here, looking for any pain, loss of function, unusual movement, swelling, deformities, irregularities, shortness of limb, crepitus or shock. I'm also going to check cat peripheral and neurological and cardiovascular impairment. So, ma'am, can you feel this? Cat refill appears to be 4 seconds, which may indicate low perfusion. So,
No.
now I have a high suspicion of fracture, so I am now think the best course of action would be to place a box splint. So I will get my offsider to help me. So ma'am, there might just be a little bit of pain, but so with the box splint we're going to line it with a towel first for added padding. So I need assistance from my offsider to just lift the under the knee and the foot while we place the box splint. So we're now just going to lift your leg and place it in the box splint for better stability. After we have placed the box splint, I am now going to place some bandages to secure the leg. So if we just lift again. Yep. So when doing this, you want to tie, so I will tie one bandage distal to the fracture, suspected fracture, and one proximal. But my patient does not meet the criteria for the nexus rule. I will now show you how to put on a C-spine collar in the case.
No.
So I've now managed the deformity of the leg with a box splint. I've managed the bleed in the arm, I've managed pain, and I've administered oxygen. I would now transport my patient to hospital. I'm now going to be placing a C-spine collar. However, the C-spine collar has been de-emphasised as it does not reduce that much head movement. However, my patient has faced a high mechanism injury, has a distracting injury, and has a decreased level of consciousness. So when applying the C-spine collar, I would first gain consent and explain the procedure. So when applying this, I would measure from the mandible to the clavicle, and then when measuring, I would do from the base of the blue to the top. So it looks like it's on the right setting. However, if I wanted to adjust it, I would just unclick the buttons and then adjust it and click them back into place. So Talia, could you now please lift the patient's head and make sure it's straight. Just place this under and around and tightening this as much as I can to reduce any head movement. Stop when entering my scene. I'm going to check for any dangers. I don't see any, however I'm just going to ask my partner. Talia, do you see any? No? Cool. Hi sir, my name's Ahliah and this is my partner Talia. What seems to be the problem today?
I'm having some chest pain.
Can you describe the pain for me?
It's like a crushing sensation.
And is that radiating or is that central?
No, it's radiating down my left arm.
Okay, so I'm just going to pop on some leads and my offsider is going to do some quick vitals if that's okay with you.
That's alright, yeah.
So I'm just popping on the leads to monitor my patient's heart rate and rhythm. So, can you tell me what you were doing when this started?
I was just watching TV. I was just sitting here watching TV and I got the chest pain and I called up the ambulance.
Yeah. And do you have any previous medical history?
I've had a heart attack in the past about a year ago.
Are you on any medications?
I'm on a range of cardiac medications.
Do you have any allergies?
No, I don't.
Can you please tell me when your last food intake was or when your last bowel motion was?
A few hours ago.
Okay. Tell you what's his heart rate? 80. So the monitor says the heart rate's 80 as well. Okay. Tell you he's collapsed. Let's move him to the floor and potentially start CPR. Once I've established that my patient is unconscious, I'm going to check for responsiveness. First verbal, sir, can you hear me? No response. Second, with a pain stimulus, sir, can you hear me? No response. I'm now going to check for breathing and chest rise for 10 seconds while my offsider takes out the resus gear.
Push, analyze.
No breathing. We're now going to start CPR while I attach the defib pads. Now I'm going to
Analyzing now. Stand
everyone
clear.
clear. No one touch the patient.
Start
AUT1 to
CPR.
comms. R49 requesting R50. Copy. I am now going to place a towel under the patient's head. And I'm now going to attach the oxygen to the bag valve mask.
Shock advised. Stand clear.
No one touch
Push
the patient.
shock button. Start CPR.
I'm going to put the oxygen on a flow rate of 15. And I'm going to insert an OPA and I'm going to measure this from the mandible to the mouth with the curvature facing up and then rotating 180 degrees.
26, 27, 28, 29, 30.
I'm holding my bag valve mask with a C and E grip and we will do compressions and ventilation at a rate of 30 to 2.
Twenty-five, 26, 27, 28, 29, 30.
While ventilating, I'm looking for that equal chest rise, and we will continue to do this for 2 minutes, and then I will swap over, and my offsider will ventilate, and I will continue with compressions.
26, 27, 28, 29, 30. Twenty-one, 22, 23, 24, 25, 26, 27, 28, 29, 30.
I will stop,
Push, analyze.
and we will now
Analysing
swap
now.
over, and I will
Stand
continue to do
clear.
compressions.
Start CPR.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26,
Shock
27.
advised.
Clear, no one touch the patient.
Start CPR.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 6, 7, 8, 9, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 10, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 4, 5, 6, 7, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Shortly, I will swap over with my offsider again, and we will continue until we see a sinus rhythm.
Push analyze. Analyzing now. Stand clear. No shock advised. Start CPR.
At this stage, I will now check a carotid pulse. If there is a pulse, we will stop CPR. But if there is no pulse, we will continue to do CPR until we are all in agreement that we can do no more, or we will stop if there is a ROSC.